If you own a dermatology practice, your front desk is likely drowning in a never-ending churn of paperwork, ringing phones, and insurance portals. If your overloaded front desk misses just 10 new patient calls a week, you are losing over $600,000 in annual revenue. The data is clear. Most practices do not have a demand problem. They have a throughput bottleneck that costs $500,000 before a patient even walks through the door. To fix that bottleneck, we have to look at what is breaking your front desk's capacity in the first place. The single largest administrative culprit is the prior authorization process. According to the American Medical Association, physicians and their staff are completing an average of 39 prior authorization requests every single week. That process burns 13 hours of staff time per doctor, week after week. Translating that into overhead, the American Academy of Dermatology found that practices spend $40,000 annually on staff dedicated exclusively to managing these authorizations. It also exacts a heavy clinical toll. 6 in 10 dermatologists report having to interrupt actual patient procedures just to deal with authorization declines in real time. The downstream impact lands squarely on the patient. A University of Pennsylvania study found that for complex dermatological conditions, the prior authorization maze routinely delays necessary treatment by weeks and sometimes months. Prior authorizations have outgrown their original purpose as a minor administrative check. They are now a structural barrier that actively degrades your patient care and drains your practice's efficiency. When faced with this crushing volume of paperwork, the default reaction for most practice owners is to try and hire more in-house medical assistants. Bureau of Labor Statistics data shows medical assistant jobs growing at 15%, a rate that severely outpaces the supply of qualified candidates. Right now, 53% of practice leaders cite finding qualified candidates as their highest operational challenge. Even when you do hire someone, keeping them is difficult. 21% of departing practice staff leave due to burnout, while 59% exit to seek better pay, often in remote roles for large hospital systems. Every time a staff member walks out, the financial damage compounds. Practices lose an employee's entire salary to recruiting costs, retraining time, and inevitable onboarding errors. Relying on a shrinking, burned-out local talent pool to manage an escalating paperwork crisis is a guaranteed financial loss.
The math simply does not work. This is why smart practices are abandoning the traditional hiring treadmill. Instead, they are migrating their heavy administrative workflows to a dedicated outsourced virtual assistant model. Firms like Staffingly offer a clinical-grade solution, providing actual healthcare professionals, including U.S.-licensed RNs, PharmDs, and MDs. These specialists operate directly inside your practice's native EHR system, following your exact internal protocols. This creates an immediate operational advantage by separating call types. Your remote team handles the heavy prior authorization work, freeing your local staff to focus entirely on the patients sitting in your waiting room. It also solves the problem of missed opportunities. With dedicated after-hours coverage, cosmetic and elective inquiries are captured and processed immediately, never lost to voicemail. Separating these duties creates an operational firewall. You insulate your practice's daily patient flow from local staffing shortages, unexpected sick days, and vacation gaps. Human expertise is necessary, but managing high-volume dermatology requests requires something more. Staffingly layers AI technology over their human team to handle the sheer scale of the work. Smart Assignment automatically routes complex work to the right specialist without manual queuing. Meanwhile, an SLA monitoring system tracks turnaround times, flagging at-risk tasks before deadlines. Finally, continuous calibration analyzes historical denial patterns, adjusting workflows to improve future approval rates. By combining specialized healthcare staff with AI-layered routing, practice owners eliminate the need to constantly monitor the administrative queue. You finally get your time back. Beyond operational relief, the bottom-line P&L impact of this model makes the decision straightforward. Let's look at the direct financial comparison. An in-house hire costs roughly $60,800 a year. A Staffingly virtual assistant costs $21,600. That yields a net savings of $39,200, a 64% reduction. But the $39,000 savings per seat is just the baseline. The true financial gain includes recapturing the revenue loss to those 10 missed calls a week. Often, the last barrier to making this change is the fear of a disruptive transition. Staffingly solved this by providing a complete oversight infrastructure so you do not have to manage the remote workers yourself. They assign a dedicated team leader for daily supervision and maintain enterprise-grade security, operating with full SOC 2, ISO, and HIT Trust certifications. Deployment is fast. A practice can fully map its EHR integration and go live within 48 to 72 hours. If you are an owner exhausted by the endless hiring cycle or a physician forced to argue with insurance portals, this is built for you. You can test the system with zero friction. Staffingly offers a 30-day free trial with no long-term contract requirements. Choosing the status quo means managing perpetual crisis. Choosing an integrated virtual model builds a reliable system for the practice's operations and patient access.